Thank you. I just go with the flow of what Nandita had said on the diet and exercise. The most important thing is that we are all used to nutritionists at our clinic. Comes to exercise, I don't know how many standalone clinics or our own clinics we do have an exercise physiologist who is going to assess what kind of exercise a patient should do, what are the comorbid conditions for which what we talked about. Now we are moving towards precision medicine. So what kind of precise exercise a patient should undergo or what he should not undergo. So here is the gray area where I try to fit in the next 10 minutes so that we can have some quality discussion. So we have some specific learning objectives. So what is physical activity? So when you say what do you mean by physical activity, I will go for the converse of it. So what do you mean by physical inactivity? I'll define what is physical activity is, which is any body movement. You are just sitting but hands are moving, legs are moving. That is a physical activity. So bodily movement produced by the contraction of the skeletal muscle that increases the energy expenditure above a basal level, that for that patient, for that person, for that age group. So the converse of it is called the physical inactivity. And if you look at it, the physical inactivity touches almost all the domains in our bodily function. Call it the digestive system, reproductive system, nervous system. Most important what we are going to talk or that most neglected would be the skeletal muscle. I'm sure that if we are going to do a bioimpedance scan in this august audience, almost 40% of you will be sarcopenic. Forget about your age. I'm talking about the muscle, that is, we talk about BMI. That's where the starting point is. But we have to move beyond BMI. Now we have to talk in terms of SMI, skeletal mass index. So we are going to talk about, physical inactivity is going to accelerate sarcopenia after the age of 30 years. Cardiorespiratory health gets deranged. And of course, today the topic, we are in the diabetic conference, so needless to say that insulin resistance, metabolic syndrome, type 2 diabetes along with obesity just worsens. Bone, so we are talking not about sarcopenia, we are talking about osteosarcopenia when there is physical inactivity. So the importance of exercise, if you look at this particular slide, negates all those metabolic ill health which I talked about previously. So exercise does increase your insulin sensitivity in both type 2 diabetic patient as well as increases the uptake of glucose by the skeletal muscles, both in type 1 and type 2 diabetic patient. Definitely you see that over a period of time there is going to be a weight loss. Nandita madam had told about the diabetic remission based on nutrition. Always mind that body always fights back to the default weight. So your BMR also, your basal metabolic rate comes down. So after a period of weight reduction through nutrition, there is going to be a plateau. There is not going to be a further weight loss. This is where exercise comes into play. So when you have this Jugalbandi, when we are talking about, is just not a compartment where you just concentrate only on nutrition alone or exercise alone. It has to be a combination of both in synchronous. So the body keeps on losing the calorie deficit. We continue to have a calorie deficit diet as well as we increase the other important health benefits by doing physical activity. So it's not the blood sugar alone. We are also talking about blood pressure reduction as well as the benefits that gives for the cardiovascular health is tremendous. So what are the types of exercise? Now we are going for an exercise prescription. So a patient walks into the clinic, so we have to tell him these are the various types of exercise. Otherwise what happens is the general concept is that exercise means treadmill running in gym or walking for few minutes every day. So that is only one part of it which is called the aerobic activity. We do have resistance training which is almost neglected. It is almost neglected when we talk about exercise. Then of course we have flexibility as well as balancing training. So what are the guidelines says? If you look at any guidelines, ADA or AHA, they talk about 150 minutes. Again remember this ADA, AHA is all national centric. It is for a different set of population. we in India have a problem of dual issue of diabetes and obesity. So the so-called 150 minutes of vigorous activity probably may not help us. So we need to increase it to the tune of 210 to 300 minutes of moderate intensity exercise or 125 minutes of vigorous activity, because we also have to take care of our overweight or obesity along with type 2 diabetes. And this has to be in combination with aerobic and resistance. And when you're talking about resistance exercise, it can be a functional training or the strength training. It need not be weight-based. It need not be gym-based. You can do all with the props at home. You can do it at home. Probably you may require a physical trainer to supervise the posturing when you're doing the activity. Later on, it can be done at home. And what about a doctor who is busy practitioner? I know that a lot of you, I think Rajiv is there, whose practice never ends, unless until his wife calls and says they come back home. So, because he's among with the celebrity, what can a person like him, who is very, very busy in his clinic, despite knowing all the good things, smoking kills, we know, but still there are people who keep smoking. So like that, we know the physical inactivity is not good, but we have other reasons for us to be there in the hospital in patients. So that is where we call exercise snacking. We can definitely take a time out from our busy practice, take 15 minutes a break, and you can do this kind of exercise within your clinic premises. You need not go and change your, of course, probably your dress has to be changed to something loosened dress so that you can have a free movement. So these exercise snackings are very important for a busy practitioner. So exercise should be performed at least, this resistant exercise, at least 2 or 3 sessions a week. It should not be done on a regular basis because you need some time for the muscle recovery, or if the muscles can get injured. So what happens when you sit for a long period of time? So more than 30 minutes of sitting or physical inactivity is almost as bad as smoking 1 cigarette. So that's a reason that I think in Mohan's diabetes update program, there is something called after every session, people get up and do a standing ovation. So some amount of activity is required in between, and you are going to see a couple of patients. I think you should walk around, do a bit of exercise snacking, and then come back. So what is the optimal time that you require to spend for a 24 hours? Sitting probably around 6 hours, standing around 5.2 hours, moderate activity. This is for a day. This is just a kind of an idea which you should know that now all of us are wearing a wearable, so you know that how many hours you are standing. And sleep, they say 8 hours. So sleep is sacrosanct. A lot of us, not in our medical fraternity, in IT industry, people hardly have around 4 to 5 hours, and the quality of sleep is always a doubt. So you should have a good quality of sleep as well. So you have physical activities. For the want of time, I'm not going into the details, but you have classified physical activity based upon light, moderate, and vigorous based upon the meds. And when it comes to diabetes, this is one important slide that you have to be careful. A patient with diabetes on insulin, you should know what kind of exercise he should do. So if you are having a patient with frequent hyperglycemic excursions, then probably exercise which includes walking, slow jogging, and swimming is going to be helpful, because that has a trend towards hypoglycemia. But if a patient has, for example, a type 1 diabetic patient goes for hypos frequently, then probably for them they have to do HIIT, that is the high intensity training, where there is going to be an excursion of the sugars that will prevent the patient from going into hypo. The best one is that you can do an alternating between, that's a team sport event. When you are doing a team sport events, you can have both a high intensity of exercise as well as an endurance kind of activity. So that will keep the blood sugar stable. So you will have to look at the patient's CGM chart if possible, especially for a type 1 diabetic patient, if you are planning for the patient, because we have a lot of runners in our community who are type 1 diabetic and who are doing extremely well. So nutrition is very important. We need to plan what kind of nutrition they should have. So glycemic control, as you know, that aerobic exercise has a modest but a significant reduction to the tune of 0.5 to 0.7% reduction in A1C when you are doing this on a regular basis. And resistance training, I think again you have different kinds of exercise, but it should be a multi-joint exercise, including the large muscles, and I have given you the chart. I can talk to you about the kind of exercise prescription later on. So flexibility, very, very important. So yoga that has come into vogue in India, not as a fashion, but for the reasons which produce a medical benefit, is going to be of immense help. especially when we become old. So we need to know to balance ourselves. So we need to have flexibility as well as something like one leg stance. And this is kind of exercise prescription that you can think of as a guideline, which you can tailor make for the patient needs depending upon osteoarthritis and whatnot. So aerobic exercise, strength training, flexibility, and every exercise should have an warm-up period and a cool-down period, so that our muscles are energized for the next day's event. Okay, for the last slide, I think this is, so to prevent diabetes also, we are talking about pre-diabetic, but when you're doing the US diabetes prevention program has demonstrated that for every 1 kilo weight loss or by intensive lifestyle, that includes both diet and exercise, you have the risk of type 2 diabetes, getting into type 2 diabetes reduction by almost 16%, very significant. So if we have a family member, of course, all of us have a family member with type 2 diabetes. So all of us should try to emulate this particular, what they have demonstrated in preventing diabetes by making sure that we lose our body weight and not the muscle weight. So whenever people over-exercise, that is also another important thing, we also lose muscle. So protein intake has to be more, which probably is almost neglected. We just focus on carbohydrate. So take-home messages, exercise helps in improving the glycemic control. Various types of exercise has to be incorporated. It's just not aerobic exercise alone. And of course, we do have some barriers. There are some, I just talked about the time factor. So we have to address them for the better adherence. So, okay, thanks a lot. Thank you.
Thank you, Dr. Kumar.